Alright, so is it okay if we discuss David's perio diagnosis today? Yeah, okay. So I'd like to talk a little bit about what periodontal disease is. It's when gingivitis is not treated, it can advance to something that's called periodontitis, and that's just inflammation of gums, loss of bone that supports the teeth, and that's really important. So David currently has some bone loss that we saw in the x-rays, like I showed you up here. And some causes can be the bacteria that like build up there, and it can like cause loss of bone. So these little parts that you see on the radiograph, that's the calculus that you can see on the radiograph. It's more radiopaque, so you're able to see it because it's been built up for a while. And then right here, you can see that some causes are when the mouth has bacteria, along with mucus and other particles, constantly form a sticky, less plaque on teeth. And then just like brushing and flossing will help. Just making sure that David's brushing at least for 2 minutes, and then making sure he's getting all the surfaces of the teeth, and making sure he's flossing every day. And if we look at his perio chart, he does have a lot of pockets that are like 4, and like on the lower right, which is this side, he does have a pocket that's 8 millimeters. So just making sure that he's really getting in there with the water flosser or even the floss. But I think the water flosser would be better because it like will actually get all the way down to the pocket. And then just going back to periodontal disease, so some risk factors can be like smoking. I know David doesn't smoke, but just being aware. And then stress can also cause that, and medications that cause xerostomia, which is dry mouth. And then, yeah, just genetic susceptibility.
I really got the mouthwash.
So I know David, for his age, he's really young. He's 38, and we are seeing that bone loss. So that's why he's more of a stage 3 grade B patient. And just some symptoms that usually come with periodontal disease are like bad breath, swollen gums, those bleeding gums that you see. You could probably observe that when he's flossing. He does bleed. And then just like if we don't take care of that, he can have like loose teeth because the bone is, you're kind of reducing it, and then it can eventually lead to tooth loss. So just taking care of that, being aware of that. And yeah, just how do you prevent gum disease? You just brush your teeth twice a day, floss every day, and then come in regularly for cleanings. I know it's really hard for you guys because it's state insurance, but just making sure you keep up with that and not waiting too long, because then that builds up again. We'd have to do a deeper cleaning again. Right. Yeah. And then, do you have any questions as of what periodontal disease is? No. Anything you want to say, David?
I do use mouthwash with the, I get them brush my teeth, I use the mouthwash.
Use a mouthwash. That's really good too because it'll help with the bacteria that forms. So just making sure he rinses and